नमस्कार and welcome to Chai Chat with Loveena. आज का चाय चैट होस्ट कर रहा है Lakeview Care Home, which is a part of Hallmark Care Homes, going on for strong 17 years. They have 17 care homes, and of them, 4 of them have been awarded the best designed care homes of UK. And why not? There is a 24-hour tea, coffee and homemade cake cafe here, and they have a beauty salon as well. You can cook your breakfast or order your breakfast, whatever you like. But the most important thing is that the 1100 people who are residents in these 17 homes are looked after by a team of 1800 people. They are not given service, but they are looked after like a family. And thus, this makes it Hallmark Family Care Home. Welcome to this care home. Welcome to Chai Chat. In UK, life expectancy has gone up. In 1980, for men, it used to be 71 years, and now it is 77. For women, it was 77, and now it's 82. That is good news. But the care for elderly, what is happening in that area in the UK? What are the challenges? Also focusing on what are the challenges when it comes to care for the South Asian, specifically Indian people living in the UK. And today, this is the focus of our Chai Chat, which we are hosting in Lakeview Care Homes. And thank you very much for the lovely panel that I have today, as always. On my right here is Avnish Goyal. He's the Managing Director of Lakeview, but of course of Hallmark Care Homes, running for 17 years, and now they have 17 care homes. Yes, and that's what brings me to the business administrator here, Inder Preet. That's right, got it. Enid Peak on the far right. Peak.
Enid.
Enid Blyton, like Enid
That's
Blyton.
right.
Enid Peak, who is the resident of Lakeview Care Home. Anita Goyal, who runs the foundation, Hemraj Goyal Foundation, working for women's rights. Serena Sangar runs her own home care business. We have Jasbir. Sugra, with a background of social care and inspector for care homes. Fantastic things coming from it. Jasbir is there. Yes. Who runs counseling and also daycare center for people specifically
and
South
support
Asian.
services for South Asians.
Brilliant. Thank you very, very much. I think we will cover and tell all the things that the care industry should do. So, should we start with you, Avnish? And does everyone allow me to call them by their first names? Yes. Brilliant. Thank you. So, Avnish, give us what are the challenges that the care industry, especially the elderly care industry, is facing in the UK?
Well, Loveena, first of all, thank you for raising this as an issue on your program in terms of older people and especially for Asians. Because that's one of the areas that I think does need focus. I think it's a really good time right now in terms of care homes. Standards are rising. We've got the new CQC regulation system that's coming in. So all the care homeowners and operators are busy raising standards. It's in the media spotlight, as we know as well. And dementia is also high on the agenda in terms of the government as well. So this is a really good time for us to be raising these issues, not only for the rest of the nation, but also for Asians and how Asians need to be accessing facilities, care homes, home care, as well as all the other facilities that are available, but sometimes they're not aware, or through stigma and cultural issues, that they're not accessing these facilities.
Yeah, but do you think we have enough, and anyone can really answer that, enough facilities or demand meeting the supply in the elderly care industry as of now?
Yeah. There are enough services around, but sometimes people are not aware how to access them.
Right. So
And because elderly people,
so
especially
true.
Asian elderly, because they don't use internet, they don't watch a lot of English TV, or they'll just like to watch Asian channels, so they don't know what is available. So people like me in the community, we go out and raise awareness about services, like dementia you mentioned. So I regularly, every week I do one workshop.
But I tend to think we have got a lot of care homes around,
Yeah.
a lot of community care available, but there's not many specific for Asians. So
Yeah.
if you move into a care home like like one we run, you got all the facilities which are great. But our Asian people are not aware the standards of the care homes have gone that high. So when you're sitting in your home, you think of a care home. I think you've got an image, and doesn't justify what we offer actually.
But Enid, the first time that you decided to move into a care home, what drove you to that and why? And how difficult was that decision?
My husband I had to put into a home, and I thought, well, if I'm there, I can feed him, whatever. And I really started to work. I was working 6 days a week. Sundays sometimes off, but Saturday shopping. And I wasn't very happy there, really. I don't know what it was. My husband was quite happy, and I went to Texas on my own, and he said no. And all the nurses said, "You've got to go. He's got all these people around him." I said, "He looks very spoiled." He said, "Oh, he is spoiled." He had a lovely face, you see. And then, of course, he was very, very sick. And I thought, well, I can't look after myself. I couldn't walk or anything. And so I woke up from the hospital finding myself in this home. And they didn't know how much it was or anything like that. It was very, very expensive. And through that, I spent the house money, my husband's money, my money, and they were still taking it with nothing. So after losing 2 stone, which wasn't very funny, I saw an advert for this, and I got in touch with Sally, and I signed on the dot. There's the paper, I want to sign it now.
But did you have to sell your house to
Oh,
cover
yes.
the cost?
Oh, yes. And that went, you see. They were full of just money, money, money. It was just ridiculous.
So what would typically a person would spend annually for the care home like yours, which has cinema and lounge and dining rooms and cooked breakfast to your choice or whatnot?
Annually, you're looking at between £50,000 and £60,000 a year to stay in one of our care homes.
Which is actually a challenging job.
Yeah, for South Asians, हमारे लोग जो South Asian community के हैं, वो मेरे हिसाब से बहुत कम, मेरा ख्याल not even 10% people would like to spend that much money. हमारे culture, South Asian लोगों में, whereas in other culture is fine. लोग अपनी केयर के ऊपर ज़्यादा ध्यान देते हैं कि अगर हम अकेले हैं घर में, so we'll rather be in a care home. हमारे लोगों को है कि नहीं, पैसा हमने बच्चों के लिए छोड़ना है, इवन इफ बच्चे उनको चाहे पूछते भी नहीं हैं, तो ये हमारा कल्चर है. सो उनके लिए बहुत डिफ़िकल्ट है छोड़ना पैसे, खासकर कि इतने अमाउंट, क्योंकि गवर्नमेंट विल नेवर पे दैट मच मनी.
और बहुत मुसीबत हो जाती है उसमें.
बहुत ज़्यादा.
और हम लोग क्या, आई थिंक एक ये कल्चर भी है कि हम अपने घर के बारे में लोगों को कैसे बताएं कि हमारे बच्चे हमारी देखभाल नहीं कर रहे हैं. और यहाँ आपका होम केयर आता है, उसमें भी आई थिंक cost cutting hui hai.
Loads, especially next year, especially the new policy that's coming out. The Care Act is coming out in March 2015, and the Care Act is going to bring a drastic changes to the care industry, whether it's home care services or whether it's care homes, and they're going to be affected a lot because the issue of choice is coming into it. The government is saying clients should be given a choice. But again, we're splitting between Eastern and Western cultures. A lot of our Asian community don't have choice. Their children make the choices. Whereas in the Western culture, like for example yourself, you were able to make the choice of going into a care home and you signed yourself. Whereas in the Asian community, the kids will make the choice and the kids will come and say, well, no, this is not right for mom and dad. But then, or yes, this is right for mom and dad. And then the person doesn't have a choice, whereas you've had total control over what you want to do and where you want to spend the rest of your life. So That's the difference.
Tell me quickly, how much would a home care cost for a person?
Again, it depends on savings. So the government will fund, depend on the need as well. If it's very complex care, where somebody is totally bedbound, needs 4 calls a day, where carers are coming in to do everything for the person, then the state funds. So the government and the social services will fund their care. But where there's savings and the person's got more than, let's say, 20,000, the state would say, well, no, you have to make a contribution to your care, or you have to fully fund your care. So it really depends on how much the person has and how much of a need they have. So it really
Different
varies.
rates हैं ना, जैसे कोई 600 pounds से लेके
सिर्फ generally for the
600
people.
600 pound से
Weekly for a
लेके
person to have an idea.
600 pound मिनिमम है अगर किसी को 24 आवर केयर से, उससे लेके अप टू 1600.
तो हर दिन कितनी केयर मिलेगी?
हर दिन उसको कोई करीबन अगर पूरा, कईयों को तो 24 आवर केयर भी मिल जाती है. हाँ, जो मिनिमम नीड है वो 650 पाउंड वीक का लेके 850 तक. जो कॉम्प्लेक्स केयर नीड है वो 1000 पाउंड से लेके 1800 तक.
Now, one line we'll do quickly wrap up. I want to know one line on the problems that exist with the care of elderly in the UK.
I think the perception by the public about what care homes do, and that's a big issue, and that's why we're busy promoting the good sides of care.
I definitely think there's a huge shortage of good carers and nurses in the country. I mean, we can run community care, we can run care homes, but at the end of the day, we need proper trained nurses. And I think NHS has recognised that we need lots of influx of nurses. So we need to focus more on nursing trainings and, I don't know, getting nurses from back home India, and because there is a huge demand. And as much as we can love to run the care homes, we need support from professional people here.
In it. What was the question?
What is the problem with the care of elderly in the UK?
Well, like my care, I'm just spoilt. I am. Inside out, I'm spoilt here. You know that, don't you?
But in the UK, I will move in with you on that note. I've seen your twin bedroom.
Have you?
Yes,
Was it
peeked
tidy?
it from outside.
Was it tidy?
It was very tidy. That made me say that, and I think I should move in with Neenad. But in UK, what do you think is the problem with the care for elderly?
It's very, very expensive. Just everything is expensive, isn't it?
Anita,
I think one of the issues in the UK is perhaps getting young people more involved with doing voluntary work in care homes, because I think they've got an immense amount to contribute.
Yeah.
And I think they would add to the happiness and the well-being of a person staying in a care home, and would really add another dimension to their life and bring some real happiness to the residents living there.
Older people love younger people.
Yeah, I think schools getting a bit more involved, and also young volunteers for sure.
It makes a more family thing.
I'm moving in.
Yeah.
I feel what affects in England is, again, lack of understanding. As much as we are a very advanced country, there's a huge lack of understanding. People don't understand care generally, and I think we need to actively promote that from the community up to government level. It's needed, much needed.
बहुत धन्यवाद आपका. Thank you very much. We're going to end up our first segment, but we have another one. Don't worry, we have another one. So, हमने बात करी कि एल्डरली केयर के साथ किस तरह की समस्याएं जुड़ी हुई हैं, ना सिर्फ भारतीय लोगों के साथ बल्कि जनरली यूके में भी किस तरह की समस्याएं हैं. अब अगले सेगमेंट में अपने चाय चाट के हम बात करेंगे कि इन समस्याओं को हम किस तरह से रिजॉल्व कर सकते हैं और क्या हो रहा है आजकल केयर होम के मद्देनज़र. हमारे साथ जुड़े रहिएगा, जाइएगा मत. बी बैक इन अ जिफी.